So in this lecture, you will learn about the desired plasma glucose level and of therapy when treating blood and diabetes patient, like how much the A1C or the fasting plasma glucose and the post brandial glucose level, how much it should be, and also the general approach to treat the diabetes mellitus. So firstly, the goal of diabetes mellitus treatment is to reduce the mortality, reduce micro and macrovascular complication, and also to improve the quality of life. And according to the American Diabetes Association, the goal of an A1C level is to be like less than 7%, while the fasting plasma glucose, like when the patient wakes up every day, they should measure their plasma glucose, and it should be between like 70 and 130 milligram per deciliter. And also, and after every meal, they should also measure the plasma glucose, and it should be like less than after every meal, like the postprandial glucose should be less than 180 milligram per deciliter. Generally, early treatment of diabetes reduces the microvascular complication, while excessive treatment, which includes like blood pressure treatment and also an antiplatelet therapy and smoking cessation, and if the patient like controlling or the lipid levels, all of these are needed to reduce the macrovascular complication, which are the coronary heart disease and also stroke. So as a rule of thumb, the patient like to treat the patient very well, and the patient should control their blood glucose and every day, like they should do self glucose monitoring. Also they should do the laboratory assessments from time to time with the physician, and the blood pressure and the lipid level, all of those they should be assessed. Also, the patient should check their dietary and exercise modification, like they should do regular exercise and also follow the dietary recommendations from pharmacist or from physician. For non-pharmacological therapy and medical nutrition is recommended for all the patients. And as for type 1 diabetes, the focus should be on balancing insulin administration with a balanced diet. Like the diet should be low in saturated fat, moderate in carbohydrates, and full of vegetables. While with type 2 diabetes, mostly calorie restriction is recommended for all the patients, and exercise is recommended for type 1 and type 2 diabetes. And for type 2 diabetes patients, the exercise can improve the insulin sensitivity to the tissues.